How many sports did you play growing up? For many kids, it's common to try as many as possible to figure out which ones they like best. Often this looks like swimming in the summer, soccer in the fall, basketball in winter, and track and field in the spring. This type of varied routine exposes kids to many different activities, exercise, and team dynamics. However, as athletics have evolved into a lucrative opportunity for the top players, more and more kids are choosing to put all their focus on one sport.
And so I think definitely over the last 10 or 15 years, as we've seen the growth of these mega clubs that are able to play 11 months out of the year and travel the country and compete and play against each other, that it's definitely grown. And even some of the other institutions that allow kids to come and train for an extended period of time. And so I would say definitely over the last 15 years, we've seen exponential growth in that situation.
That's Nathan Fitton, a team physician for Michigan State University Athletics and associate professor at Michigan State University College of Osteopathic Medicine. He and a team of researchers recently released a paper in the Clinical Journal of Sport Medicine. Their investigation tracked how this shift into hyperspecialization has impacted the health of athletes.
As someone who's in his 40s, growing up, you didn't have the opportunity to play one sport year round. It just wasn't there. And so by default, we ended up playing, 3 seasons, 3 sports. But as we've seen the evolution of club sports and year-round sports, I would say from an injury perspective, we're seeing kind of what's consistent with this study in the sense that kiddos are seeing injuries because of more repetitive actions and higher risk motions that they're just doing again and again and again, as opposed to having the opportunity to diversify.
The research team surveyed more than 200 student athletes playing at the collegiate level.
We looked at Division I, Division II, and Division III athletes, and we asked them 3 simple questions. Did they focus on one sport in high school? Did they quit other sports to do it? And did they train in that sport greater than 8 months out of the year? And based on their answers, we grouped them into low, moderate, and high specialization. The more yes answers, the more specialized they were. And so what we found for the kiddos that answered yes to all 3 of those is that there was a clear pattern between these highly specialized athletes and increased injury risk that was not due to chance or other external elements. We found that kiddos that were highly specialized were 5 times more likely to have sustained an injury than the low specialization, and they had triple the risk of needing surgery to correct that injury.
Then, when they looked at overall recovery times, the team found that the athletes who were highly specialized reported needing 30 more days of recovery than the other groups. Despite the longer downtime, these athletes were also at a higher risk of re-injury when they were finally able to return to their sport. By analyzing the recovery time, the research team was able to capture how the rate of serious injuries fluctuated between the 3 groups.
And so for the low and moderate specialization, the average recovery days was just over 2 months. In the highly specialized, it was approaching almost 4 months. And so that would tell you that the injuries that were brought up or that they were reported were more significant and severe injuries. So maybe they were, a significant joint sprain or a significant muscle sprain or tear or something that needed surgery.
Each athlete's recovery times were reported based on how long it took before they were able to return to their sport. That may mean being a practice-only player or being able to fully compete in matches. But if focusing all your efforts on one sport dramatically increases your chances of serious injury, why aren't we seeing the same trends when we move the scope from high school to the professional level?
I can't speak for certainty, but I definitely know that in that professional level, they're getting a variety of exposed experiences to help with this, right? And so it's the awareness that they need to diversify, but at the same time, they're not growing anymore. And so there's that factor that comes into all of this as well, is that as in our adolescence, we're still growing. There's still, bones are not as strong as muscles. So there's that type of injury pattern versus as we age and our growth is over with. So it's a little bit of a different injury pattern and injury risk we would potentially see.
Athletes going through puberty are more likely to develop growth-related overuse injuries. In kids, bones grow faster than muscle, which makes them more vulnerable to muscle and tendon damage. And sadly for some athletes, one injury may be the first of many. A 2020 study published in the journal Sports Health assessed the risk of re-injury for athletes under 20 years old. It found that of those returning to sport after ACL reconstruction, 1 in 5 would suffer another tear in either knee. Fitton hopes that since these findings are out there, athletes will be more intentional about diversifying their activities.
What we're trying to get out there is that just one season off dramatically reduces injury risk and surgical risk for those particular injuries. So our goal with this is just to bring forth that highly specialization is dangerous to student athletes, but it is not far off or difficult to lower your risk through a shift of just about 3 months. If you can get that 3 months to do something different, to enhance other skills, to take a break, to take just a mental break, to allow yourself to explore other things, and then come back to your sport, you're going to dramatically reduce the risk of injury and potential need for surgery.
In fact, the group of athletes that had low specialization and were part of multiple activities throughout the year showed such low rates of injury that a majority of the respondents had never had an injury.
Whereas in the highly specialized, over 75% of those kiddos had a substantial injury. And so you can see how it escalates as you would imagine, but these are still all college athletes, right? So what we're trying to get away from is, well, they're low specialized, so they can't work as hard. They must not be as talented. No, we don't see that. We don't see hours spent in per week training when they are in season different from side to side, from high to low. Rather, they all commit when they're in that sport. It's just the low specialization goes on to different sports and does different things. And so I would say that the one sentence takeaway from this is find a sport you're passionate about, that's fine, but try to take one season off to see a significant reduction in your risk of injury and potential need for surgery to correct that injury.
High school and youth sports programs can also use this information to inform their training protocols. You can find more information about Nathan Fitton and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.